The external oblique attaches at the anterior iliac crest and also at the pubic bone, at the pubic tubercle and the pubic crest, and the abdominal aponeurosis, and then it's going to insert into the inferior border of the lower 8 ribs, so ribs 5 all the way down to 12. And because it crosses the ribs, the trunk, and the pelvis, we know it's... Hey everyone, Steven here with TV4, and this week's YouTube shorts are dedicated to the external oblique muscle. The external oblique is one of your abdominal muscles. It's deep to the rectus abdominis, and one of its actions is going to be retroversion of the pelvis, which makes it a very important muscle, especially in managing something like low back pain. If you recall from earlier videos, one of the reasons why most people develop low back pain is due to dysfunction in the lumbopelvifemoral complex, and one of the most common postural faults in the lumbopelvifemoral complex is going to be excessive anteversion of the pelvis, or an anteriorly tilted pelvis. So one of the ways in which we can mitigate that and decrease symptoms of low back pain would be to do some strengthening exercises for the external oblique muscle. For the external oblique, there are only 2 areas that we need to be covering, and that is going to be the pelvis and the rib cage. At the pelvis, this right over here is your ilium, and at the side, we have the iliac crest right over here. And then just inferior to that, the most inferior aspect of the pelvis, we have the pubic bone. Right over here is going to be the pubic tubercle and the pubic crest, and that's pretty much it in terms of the pelvis. Then, let's go move up to the rib cage. At the rib cage, right over here is the manubrium, then we have the sternum and the xiphoid process. That makes up your breastbone, and then just lateral to that, we have the ribs. With regard to the ribs, the most important ribs that we need to make note of are going to be ribs 5, 6, 7, 8, 9, 10, 11, and 12, and those are the only important bony landmarks when discussing the external oblique muscle. The external oblique attaches at the anterior iliac crest and also at the pubic bone, at the pubic tubercle and the pubic crest, and the abdominal aponeurosis, and then it's going to insert into the inferior border of the lower 8 ribs, so ribs 5 all the way down to 12. And because it crosses the ribs, the trunk, and the pelvis, we know it's going to have an action at all 3 of those areas. At the ribs, its main action is going to be depression of the rib cage. At the trunk, when they contract bilaterally, it's going to be responsible for flexion of the trunk. When they contract unilaterally, they're going to be responsible for lateral flexion of the trunk and also contralateral rotation of the trunk, so rotation to the opposite side. And then at the pelvis, when they contract bilaterally, they're going to be responsible for retroversion of the pelvis. And then when they contract unilaterally, they're going to be responsible for ipsilateral elevation, so elevation to the same side, and then ipsilateral rotation, so rotation to the same side. But those are the actions of the external oblique muscle. The external oblique is innervated by the intercostal nerves, and more specifically the ventral rami of your T7, T8, T9, T10, T11, and T12 nerve roots. And the reason that's going to be very important is because if we have any type of damage or compression to the nerve roots in those areas, then the nerves are not going to be able to send the proper signal to the external oblique to fire properly, and that can lead to limited blood flow and oxygen in the area. So what we can do to address that would be to do some ELDOA exercises. The whole reason the ELDOAs are going to be great is because the whole purpose of an ELDOA is to create space within a joint. So if we're able to create space within the joint, we can improve the function of the nerve roots, and then the nerves are going to be able to send the proper signal to the external oblique to fire properly, and that can improve blood flow and oxygen in the area. Today I'm going to be taking you through some strengthening exercises for the external oblique muscle. I'm going to be taking you through 2 different variations, each of which are going to be in a supine position, meaning you're going to be laying down on your back. This first one's going to be for the supraumbilical fibers, so your upper abdominals. You want to go ahead and flex your knees to 90 degrees, plant the feet firmly on the floor. We've got retroversion pelvis, flat lumbar, flat thoracic, keep the chest elevated with the contralateral hand, cup it over the shoulder with the ipsilateral hand, maximum extension of elbow and wrist, maximum external rotation of shoulder, and then go into adduction. For the principle of action, we're going to do a combination of flexion and rotation, and we want to make sure that we cross the midline, and this is for the supraumbilical fibers. Then, if we want to target the subumbilical or lower abdominals, what we want to do is with the ipsilateral leg, flex the hips and knee to 90 degrees. With the contralateral leg, we're going to wrap it up over top and go into 30 to 45 degrees of adduction. With the arms, we're going to go into the level of the glenohumeral angle, and we want to drive the knee toward the shoulder. And this is to target the subumbilical fibers. Those were the 2 strengthening exercises for the external oblique muscle. For the external oblique stretch, we're going to be in a kneeling position, and what we want to do is go ahead and take the contralateral hand, so the hand opposite to the side that we're stretching, and we're going to grab a hold of our Achilles. Then, we're going to go into slight lordosis of the lumbar spine. And with the ipsilateral arm, what we want to do is place it over our ear, and we're going to do that to put the pectoral fascia under tension. At the spine, we want to do a contralateral side bend by bending away from the side that we're stretching, and then ipsilateral rotation by rotating toward the side that we're stretching. And then at the cervical spine, we're going to mimic what we did in the spine. We're going to do a contralateral side bend by bending away from the side that we're stretching, and ipsilateral rotation by rotating toward the side that we're stretching. And this is the myofascial stretching exercise for the external oblique muscle. For the T7, T8 ELDOA, we're going to be in a seated position, and we want to flex the knees as much as we can until the lumbar spine starts to round. As soon as the lumbar spine starts to round, we're going to stop right there. We want to create a lemniscate in the lower body to create maximum myofascial tension. We're going to do that by raising the big toe up, flattening the medial arch, going into external rotation tibia, medial rotation of femurs. Keep those knees nice and tucked in. We're going to maintain retroversion of pelvis. Flat lumbar, flat thoracic, chin tucked in, crown to head up, eyes looking down at the floor to put the dura mater under tension with the arms, maximum extension of elbow and wrist, maximum external rotation of shoulders, flex the shoulders to the level of coron plate, so biceps in line with the ear. Then we're going to lower the arms to the level of the glenohumeral angle. If you don't know where that is, depending on your morphology, anywhere from 90 to 135 degrees. For the average person, when your arms are fully extended and the palms at the level of your forehead are slightly higher, that's going to be the level of your glenohumeral angle. We're pressing away with the palms, up with the crown of the head, keeping those knees tucked in, and this is the T7, T8 ELDOA.